Good evening. You were involved in a wreck that leaves you paralyzed from the neck down. You are unable to breathe on your own, but luckily, a bystander has already called 911 and an ambulance is less than 30 seconds away. You lie there, hopeless, unable to breathe and starving for oxygen until a paramedic places a mask on your face and begins to use a device designed to breathe for you. Hello, my name is Matthew Goines, and I have a profession that puts me into this very situation quite often. I'm a 911 paramedic. We train quite often on how to manage patients' airways in acute/life-threatening situations. One of these ways is called drug-assisted intubation. What is intubation? Intubation is when a trained, credentialed provider places a plastic tube into your trachea, allowing you to breathe via an external mechanical device. The large plastic tube can be compared to a straw, a large plastic straw that goes down into your throat, and a mechanical device will connect to the top and will allow the providers to breathe for you. So where does the drug-assisted part come from? For simplification, drug-assisted refers to the using of pharmacological measures to facilitate the passing of the endotracheal tube into the trachea. Remember, the endotracheal tube is that large straw that goes into your throat. Oftentimes, it includes a sedation medication to induce sleep and a paralytic medication that places the patient into a temporary state of paralysis. We will touch more on the paralysis part in a second. Now, why do medical providers need drugs to perform endotracheal intubation? If you stick your finger down your throat, what happens? You will trigger your gag reflex, and you might even start to vomit. So the use of medication allows trained medical providers to place the patient to sleep, which removes anxiety and awareness of the events taking place. And the other medication will temporarily paralyze the patient, effectively removing the gag reflex, allowing vomit risk to be mitigated and the effective passing of an endotracheal tube. To summarize this very simplified explanation of drug-assisted intubation, or DAI, the ending result is the effective management of a patient's airway when they are unable to do so themselves. Broderick et al. 2023 states that this procedure saves lives. So what's the big deal? Jarvis et al. 2025 states in one study that the first pass success rate of an endotracheal tube during a DAI attempt is 75.1% in the out-of-hospital setting. This similar results were found in Crucent et al. 2017 when they found 77.8% was the amount of times that the endotracheal tube passed the first time. Another study from Jarvis et al. 2022 found that 36% to 45% of DAIs in the emergency department and EMS had periods of hypoxia, which is characterized by severe depletion of oxygen in a patient's body for a period of time. These are just a few statistics from established peer-reviewed journals in the industry and can be summarized as this. This intervention is life-saving. However, medical providers can be better. This is a skill that effectively puts a patient into an unresponsive state, paralyzes them, and removes their ability to breathe on their own. It entrusts the medical provider to take the sequence of steps necessary to effectively complete the skill safely without adverse outcomes. Medical providers undergo a lot of stress in their field of practice. They are expected to show up every day and be sharp enough to perform invasive skills such as the one mentioned above. Newman-Tucker et al. 2022 estimates that 130 million emergency department visits per year in the United States, that 7.4 million patients are misdiagnosed, 2.6 million suffer an adverse event as a result, and about 370,000 suffer serious harm from diagnostic error. Mind you, medical providers are also humans too, and human error can be shown to have a great effect on this population. This shows that despite the copious amount of training and licensing requirements that go into becoming a medical provider, human error is still prevalent. Medical providers must continue to train and educate themselves with their skills and general knowledge so they can continue to provide high acuity interventions such as drug-assisted intubations. DAI is an important life-saving skill that when used correctly and when trained on correctly can dramatically benefit patients in need. Again, this is especially true if the skill is utilized by educated and sharp medical providers. Thank you.